Despite the Affordable Care Act, health care costs continue to increase faster than inflation. And now the Government Accountability Office, or GAO, says states and local governments will face severe budget pressure over the next 50 years, and due to rising health care and pension costs. One American News' John Hines has the story from Washington.
The New Year's message from the investigative arm of Congress, otherwise known as the General Accountability Office, or GAO, is not a good one for state and local budgets. This is Michelle Sager, Director of Strategic Issues at GAO.
State and local governments face tremendous fiscal challenges, both now as well as 50 years into the future.
GAO Sager says there have been many changes in the healthcare sector, but that despite implementation of the Affordable Care Act, healthcare costs keep rising and pressuring local budgets.
Now, of course, during the time that we've run our model, the Patient Protection and Affordable Care Act became a public law, and so the healthcare sector has changed a lot. But what has remained the same is that healthcare costs have increased more than GDP, something called excess cost growth. So healthcare costs continue to grow faster than gross domestic product. And when you look at the sector as a whole, this creates a tremendous pressure as they try to pay for their Medicaid expenditures as well as their healthcare expenditures for current employees as well as retirees.
Sager says that these budget pressures show up in different ways depending on the particulars of a state or locality.
So the way that it manifests itself, again, varies quite a bit depending on the individual state or locality. Certainly they pay close attention to how the rating agencies rate them, and then through the annual budget process, as they're trying to bring, again, the revenues and expenditures into balance, they face a whole range of choices.
Sager is careful to point out that her model is illustrative, not predictive. That is, GAO cannot predict an outcome, just a trend, which means that eventually many states will be faced with policy choices, like raising taxes or cutting spending, or possibly a little bit of both. John Hines, One American News, Washington.